Sarah, thanks for being willing to share a testimony of the training. Over the last few weeks, I know your staff and some members of your it's affiliates who are alumni of your institute, um, all basically from or affiliated with the Psychotherapy and Spirituality Institute of New York City. And you took a custom webinar training on best practices in telehealth. And just want to ask a couple of questions. And first of all, what prompted you to seek a training for your staff? Why was it that you thought this would be important?
Well, it started with one of my colleagues who had seen advertisements for some of your trainings online and had forwarded them along to me. And it really initiated a conversation with the staff about here we are 2 years in, we've shifted our practices entirely virtual and did so out of necessity and urgency, right? And now here we are, and the necessity and urgency has decreased a little bit, but the fact of the matter is telehealth is here to stay.
Right.
And so I started wondering, are we doing the best that we can in the provision of services to our clients? Do we know what we're supposed to be doing, what we can be doing, what we need to be communicating to our clients? And so I reached out to TCI, and you all were really helpful in creating a program that was going to be specific to my institute and our needs.
Wonderful. I'm glad that we were able to do that and that it worked out. Regarding the training itself, you had 3 webinars where we covered different topics. How do you feel your staff and yourself as a clinician, how did you most benefit from that experience?
Well, I think more than anything, it was just helpful to know what we don't know. To have someone else who is really rooted in their research and study of what's out there, what are the laws, what are the policies, what are the best practices. The fact is Ray laid out an enormous amount of material. 4.5 hours seems like a long time, but it's, truly just scratching the surface of what's out there in terms of providing really good telemental health. And so I think for us, we've been left with more questions than answers, but it's giving us a jumping off point to say, now what do we want to do next? What kind of policies do we want to craft? How do we all want to improve our individual practices and then our policies as an organization? Ray also offered a lot of resources. So what we didn't get or what we have follow-up questions for, now we know where to go to get them. We go back to TCI and do another training, or the fact of the matter is you have an enormous amount of material on your website that's free for people to access. And so now I know where to go next time I have a question. I didn't know where to go last time. I didn't even know what the questions were I was supposed to be asking. Now I know what the questions are, and I know where I need to go to get the answers.